everyone, feel free to mute yourselves and turn off your cameras if you like. And I'm going to hand it over to Stephanie.
Thank you, Dottie. Well, thank you for inviting me tonight, and our topic is Medicare and You. I heard that we do have a wide cross-section of people joining us tonight. Some of you are about to retire, some recently retired, and some retired quite some time ago. So I'm really hoping that everyone will find some tidbits tonight that they will find helpful. So Medicare was passed by back on July 30th of 1965. So established both Medicare as well as Medicaid. Medicaid is for low-income individuals. Medicare is generally for those that are 65 and older. So we're going to talk about different aspects of Medicare and how it's changed. And the Medicare and You is a great resource. It's got a lot of information in it. So that is available on the Medicare.gov site, and I'll be mentioning that later as well. So tonight, as we promised, we will go through the ins and outs of Medicare, including an overview of various parts of Medicare. Parts, we like to think of it, the ABCs, parts A, B, C, and D, Medigap plans, initial, annual, and special enrollment periods, and helping subscribers better understand which plan might be best for them. So when you think of Medicare, Part A is the actual hospital insurance benefits. It also includes skilled nursing facilities, rehab, and hospice. It does not cover custodial or long-term care. That's always a question that we get. It has a level of skilled nursing, but it's not custodial or long-term care. Part A usually is free for individuals. There are some that pay, but most people get Part A coverage at no charge. Part B is supplemental, and it has a wide range of outpatients. So this are your physician visits. It also includes the durable medical equipment, lab tests, and certain preventive. Part B, though, does have a charge. And so the 2021 guide just came out for Medicare and You, but it was published and it did not have the rates yet. The way that the Part B premiums are set up is it's based on your income 2 years before. So you'll see for 2020, it's based on the 2018 income and starts at $144.60 per month and goes all the way up to almost $500 a month when you're in the highest income bracket. So we are expecting the 2021 premiums to be announced that would then be based on the 2019 income. Part C is the Medicare Advantage plans, and we're going to spend a little bit of time talking about that. It covers the Part A and Part B benefits, but you would purchase A, you would have A and B in order to purchase Part C. And then Part D, it's interesting. So when Medicare was passed back in 1965, there was no coverage for prescription drugs. And it wasn't until 2006 that Medicare started covering prescription drug coverage, and that's in Part D, D for drugs. That's an easy way for me to remember it. One of the interesting things here was when it was set up, you may have heard a lot of discussion about the donut hole, getting stuck in the middle of the donut hole. And this was something my mom always had a problem with. She'd have a lot of prescription drugs, and she'd always say she gets to the donut hole. And what this is, here's an illustration. So you look at a year from January through December. You have coverage beginning in January. There's some initial coverage by the plan, and then you get to this coverage gap, or that's where the donut hole is, with little or no coverage. And then it kicks back in catastrophic coverage and then covered through the rest of the year. So one of the things was always that seniors would have a problem because there was so much in the donut hole. So when ACA or Obamacare was passed, one of the things that it was to try to work on closing the donut hole over a 10-year period. So this shows how it came out, and in 2020, we're at the level for 25% of cost sharing in that part. And this graphically shows you in 2020 where it was, where the individual pays the first 100% of $435, and then you progress through. The book did share, so the number went up. So the first part would be $445 for 2021. And you see that you're getting to that 25% in that coverage cap or the donut hole part. So that's Medicare, parts A, B, C, and D. And I'm going to be going back and talking a little bit more about C, but now I want to look at Medigap. So when you get into Medicare parts A and B, there are parts that you would be paying, deductibles, coinsurance. So if you want to fill the gaps or supplement parts A and B, you could purchase a Medicare supplemental plan, or it's called Medigap. These are sold by private insurance companies to fill the gaps of the original Medicare parts A and B, and they cover all or a portion of those cost-sharing parts. Some benefits that are not covered, such as extra days for inpatient or foreign travel or for emergency care, are also covered by the plans. And one of the things that they did is they set them up so that they would be in letters. So the letters go between A and N. And so that seniors, regardless of what they have, every plan A has to cover the same features. So the company would be different, you know, whether it's Humana or Care First or United, but the actual benefits, if you buy a Part A or a Part B plan, they would be the same. Now, one of the changes was that for plans that are issued after January of 2020, they cannot cover the Part B deductible. So that limits, you'll see here, the plans C and F are not available to new people because they were covering that. And not every company offers all the letters. So that's something, you know, that you would look at, like we used to say, oh, plan F is the best one. And now, you know, there's more of a limit for the newer individuals. So which path is right for you? Okay, everyone has their own circumstance, and, you know, cost is a factor, convenience, the doctors, and how limited you want to be. So you start thinking, what would be best for you? Basically, there are two approaches. The first is the original Medicare option. This is where you have Part A and Part B, the hospital, and then like the outpatient. And you're able to use any doctor or hospital that takes Medicare anywhere in the US. People would start with A and B, and then if they go on the original approach, then they would be adding, if they want for prescription drug coverage, a Part D, and then to help pick up the out-of-pocket cost, they would get the MedSup. And that's what we were talking about. MedSup will pick up a lot of the out-of-pocket costs that are not in A and B. So this is one approach. You have your A and your B, and then you get a MedSup and a Part D. Or you go the other approach. The other approach is to go the Part C or Medicare Advantage side. Now, this is more of an all-in-one alternative. So when you're working and you had a plan and the plan had medical and prescription drug and it was through a private carrier, it's more similar to that approach. So a lot of people think of it like that. This is an area that's had a big growth. We used to just see everyone getting the med sups and then the Part D. Now we are seeing a lot of individuals interested in Medicare Advantage. In order to get a Medicare Advantage or a Part C plan, you do have to have A and B, okay? And what this is you have A and B, so A is usually free, B you're paying for, and the plan, you know, if it's say United Healthcare Medicare Advantage, they pay all of your claims. So they're receiving money from the government and covering all of your claims, as opposed to the first way, which was Medicare picking up, and then if the Med Sup covered some things too. Some of the Medicare Advantage plans have a D built in. So it could be totally all in one, where you have your medical and prescription drug in one plan, as opposed to two separate plans. Other times they don't have it, and you would get a Part C and a Part D. Okay. One advantage for these plans, sometimes you can get them at no charge even. They usually have lower out-of-pocket costs than original Medicare, and they also have a yearly limit on what you would have for your out-of-pocket cost. So the out-of-pocket maximum, which is a term that we use like when you're working and you're in a group plan. So you know, if God forbid something happened, what is the maximum that you would have to pay? So these plans are set up that way, where it's, you know what the maximum would be. And as I mentioned, some you don't pay any monthly charge for. So if you went this route and there was no monthly charge, you could just be paying for your Part B, and then you have A, B, and C and D all in one. Now, some of the disadvantages is there's more of a limit in terms of the doctors and the networks. So this is similar to when you were in a actively working and in a group plan where you're maybe limited to going to doctors that are in the network. You do need to be in a specific service area when you're getting this. And very often, and this is another advantage, is that they cover items that would not normally be covered. So vision, hearing, dental, maybe fitness benefits. There are a lot of things that can be built into these plans that you get that you would not get otherwise. So if you went in the original one where you have the A and the B, and you purchase the Med Sup is just picking up the medical pieces of A and B, like deductibles and copays, but it's not adding things like vision or dental or fitness. And then you'd have the D versus going in an all-in-one. Now, I know, for example, that Care First is coming out with Medicare Advantage plans effective January 1st. They were just presenting those to brokers. So, you know, we're aware of that. I can't give you any specifics till after October 1st, but those plans are new to the market for this area. So enrollment periods. So those of you that haven't hit 65 yet, you'd be focused on the initial enrollment periods. So it's a 7-month period. So this is when you can first sign up for A and B. Remember, it's effective, you're eligible when you hit 65. So if you're in this category, you're usually getting that Medicare and You book, or you're getting a lot of solicitations, you know, your initial period's coming up 3 months before you turn 65, the month that you turn 65, and 3 months after. So that's how you get to the 7 months. If you sign up in the first 3 months, then your coverage would generally begin on the first day of your birthday month. So if you're going to be turning 65 next month in October, and you've signed up and your birthday is October 15th, you could get coverage on October 1st. But if your birthday is the first day of the month, it'll start the first day of the prior month. And then if you enroll the month you turn 65, or during that last 3 months of that 7-month period, it won't start when you hit 65. It'll be starting later. But this is a critical time that you would not want to miss. So we're going to make sure that you're aware of that. And then for those of you that are working, you may not need to worry about it until you end work. If you didn't sign up at that time because you have, for example, your group health plan based on your current employment, so that's you that are working and you're covered by your employer, or maybe your spouse is working and you're covered as a spouse or family member if you have a disability, you can sign up later under what's called a special enrollment period. So you're covered by the group plan, and here it's an 8-month period that begins after your employment ends or the coverage ends, whichever happens first. So that's a special enrollment. Then I've met people that have missed the boat on this, and they go in for their general enrollment. So this is when you didn't get it during the initial and you don't qualify for a special enrollment, you can still sign up under a general period. So the general period runs January to March, but the coverage doesn't start till July 1st. And you may be facing penalties as well. So there's still an opportunity, but there can be penalties. And I have met people that got confused or missed information and they missed it or thought that they could wait. And then the only thing they could do was go under this general and have it start later. So we had our fingers crossed that nothing happened to them because they didn't have any coverage until the July 1. So you don't want to be in that boat. And then as you're, you hear every year, there is the open enrollment period. So this runs from October 15th to December 7th. This allows you to make changes for the next year that would be effective January 1st. So next month, October 15th to December 7th of 2020, you can make changes that would be effective January 1st of 2021. Note, if you have a MedSup or a Medigap plan and you drop that because you say, oh, it's great, let me sign up for a Medicare Advantage plan, you may not be able to get it back. Or if you drop your Medicare Advantage and return to original Medicare, you could be limited in your ability to get a Medigap policy. What Medigap is, when you sign up for a MedSup during your initial enrollment, there are no health questions. No matter what your health condition is, they have to take you. When it's after that, they start asking questions and they may not take you, they may charge more. So you want to think carefully when you're making these decisions. I mentioned there are penalties. So there are penalties on the Part B side and the Part D side. So if you don't sign up for Part B when you are first eligible, there is the late penalty for as long as you have Part B. So it could go up 10% for every 12-month period that you could have had B and you didn't sign up. Now, if you qualify for that special enrollment period, so that's why you're getting B later, you don't pay the penalty. So you really need to understand, I have people coming to me all the time, you know, do I have to get B or not? And, you know, so if they would qualify later for special enrollment or they're in a situation where they wouldn't need it, then they're fine. If not, and these are the people when I was talking about that general enrollment, they signed up late and then they were subject to penalties, you know, for their life. Part D, the drug, this is one that a lot of seniors that I've talked to say, I'm not taking any medications, Stephanie, why do I need to get the Part D plan? Well, you want to get it because if you decide later that you want it, then you would be subject to penalties. So you want to get something when you're eligible for it, and you can make changes and you can switch your Part D plan each year during open enrollment, but that way you don't have to pay a late charge. So the late penalty is any time after your initial enrollment period is over, if you have a gap for 63 or more days in a row that you do not have drug coverage, or other credible coverage. So the credible coverage, if you're in a group plan, every year the group plan needs to determine if it's credible coverage, and you'd receive a letter that you're able to take with you when you sign up for Part D to show that you've had credible coverage in place. If you don't have that and you have the gap, then you'll pay the penalty for as long as you have the drug coverage. This penalty depends on how long you didn't have it, and it's calculated by multiplying 1% of this national number, and the national number for 2020 was the $32.74, by the number of uncovered months that you were eligible but didn't enroll, and you went without coverage. So here this gets added to what your regular cost would be for a Part D plan. So that's why you don't want to miss the boat, because you'll be paying more for the rest of your life. Now, here's something that comes up quite a bit. So for those of you that are working, you have coverage at your company, you are thinking, what do I need to worry about it or not? How does Medicare come into play? Well, back in 1980, Congress passed legislation that made Medicare secondary to certain plans to help shift the cost. So this helps keep the costs down for Medicare by having your company's group plan pay as primary and having Medicare as secondary. So for those of you that are working, okay, covered by a group plan, you could be a spouse on the group plan. If your employer has less than 20 employees, the Medicare is primary and the group plan is secondary. So they will pick it up when it's small companies, because that's a lot less dollars that they're putting out. If your company has 20 or more employees, then your company's plan is primary and Medicare is secondary. So this is the way that they keep down some of the Medicare cost, by saying that the group plan needs to pick up and be primary. I thought I would share some helpful tips of things that have come up over the years. I've been in the industry now for 35 years, and so different things come up. One has to do with people that are on COBRA. And they think that, oh, they're fine. And what happens is, the way that the legislation is written is that it needs to be based on current employment. So if you have COBRA, which is like if you've lost your job or left and you have continued coverage, that COBRA goes back to 1986 law to allow you to continue your medical coverage, then that's not on current employment. So you would not be eligible for a special enrollment period to sign up for Medicare when that ends. And that has been a big thing that people have been confused on. They think, oh, COBRA will be ending, then I'll sign up for Medicare. Well, these people run into a problem and they end up paying the penalty because they're not eligible for special and they miss the time that they were supposed to sign up. So it's very important to keep that in mind. Now, if you're on Medicare and then eligible for COBRA, then that's a little different. But if you're on COBRA and then eligible, then you do not want to miss the boat. Your COBRA would end and you pick up Medicare. The other thing has to do with buying Medigap policies. So the best time, as I was saying earlier, is during your initial time to get the policy, when you first would be eligible for Medicare A and B and then could purchase the Medigap. Okay, you would have A and B and then purchase Medigap. After that period, you may not be eligible to get it, or it could cost more, because as I was saying, they will accept everyone at your initial enrollment. But if you decide later that you want it, then they're going to start asking you, and you may or may not get it, or it may be more expensive. So you definitely don't want to miss and delay signing up for that. Now, if you're in the situation where you delay getting Part B because you have your current company's health insurance for you or as a result of your spouse working at a company, remember you have a later time to sign up. You're under special enrollment and Medigap follows those rules, so you're fine. Once you're eligible for B, then you're signing up for Medigap. No problems there. The other thing that comes up for those of you that are working is the impact of health savings accounts. So a lot of companies now are offering high deductible plans that are compatible with a health savings account. There is in the rules, in order to make contributions to a health savings account, you're not allowed to do it if you have Medicare coverage. You can use money that's in your account to help pay for premiums, deductibles, coinsurance, or copayments. In fact, HSAs are sometimes termed as medical IRAs. But if you are contributing to an HSA after you get Medicare and you're covered by Medicare, you're going to have a tax penalty. So you do not want to do that. So you can still participate in the underlying medical plan, but contributions made by you or by your employer, or you're subject to penalties. So if you want to continue contributing to an HSA without a penalty after you turn 65, do not apply for Medicare or Social Security. And then if you want to avoid the tax penalty, you would stop contributing at least 6 months before you apply, because the Part A that is free, if you get it after you turn 65, it can go back 6 months, but not earlier than the 65. So if you continue working and you're picking it up later, it's a 6-month look back. And so you want to make sure that you were not contributing during those 6 months. So important dates to keep in mind, so we're at September 29th now. So beginning October 1st, you can start comparing your current coverage for those of you that are currently on Medicare and look at different options if you want to make a change. Your open enrollment period to change Medicare Part D coverage to be effective January 1 is between October 15th and December 7th. The new coverage would take effect January 1st, okay? Now, if you're on Medicare Advantage, you can also, from January to March 31st, you can change to a different plan there. So there's a different enrollment period for that. Medicare.gov is the site, has a lot of great information. So for those of you that are approaching 65 or want to start looking at it, you can go to this site, you can put in information, your date of birth, your zip code, and it'll show you all of the options that are available in your area and what the cost is. I spend time and I sit down with people and, I do consulting and I can walk them through things or help determine what might best meet their needs. This is where the Medicare.gov book is available. And as I mentioned, the 2021 version is on the site now. And so it's a thick book, but it's got a lot of great information in it. Those are my prepared remarks. I hope that you found this useful. I'm not sure how many questions we have, but I was trying to leave plenty of time for questions. And this is my contact information, as well as if you think of something later or you need some help. As I mentioned, I do sit down and do consulting. I can go into more depth, about A, B, C, and D, Medigap, different periods. There are different products that I can sign you up for. And I mentioned, for example, the Care First Medicare Advantage plans are being released for our area. So, Dottie, if we have questions that have come in, or.
Yeah, we're going to start reading off some of these questions, or I can also send them directly to you in the chat so that you can answer them one at a time, if that works.
Okay. Let me go back to the other view, I think.
So people are able to just ask their questions in the chat.
Do you want me to, I'll stop the share. Okay, now I can see everybody. Oh, okay. Dennis, I'm sorry, I'm seeing this now that the presentation didn't show completely. It got cut off. I hope you're able to see it. I think if the view. Okay. There's a question about coinsurance and deductible. So deductible is what you have to put in before the plan starts sharing in the cost. So say you're subject to the first $500, and then after you meet your deductible, it moves into coinsurance, which is a sharing of what you and the plan pay. And that's like, say you pay 20% and the plan pays 80%. That's what deductible versus coinsurance. The next question has to do with Medicare Advantage's plans being more cost effective. I am seeing that it's much more predictable cost. So individuals that are more focused, that they want to know what their out-of-pocket costs are, and as I mentioned, they have a total limit on what it would be, so that if something happens and you know that that's the most that you have to pay in a year. The other thing that they do is they will add more benefits in. So I'm always having seniors that are asking, can we get dental? Can we get vision? What about hearing, fitness? So Medicare Advantage do offer a lot of those other benefits. And so if you think about, you know, purchasing all the other plans and you could roll it, or if you can get a Medicare Advantage plan at little or no cost, I would say that it is, you know, more cost effective in that way. Okay. The coordination with Medicare and VA benefits. So that goes to what would be primary and secondary. So that's another coverage. If you have your own retiree medical plan, I'm not sure how those are set up, that's probably going to be your primary coverage. And then you would have it would have A and B. You would not need to go purchase a Med Sup or Part D if you have medical and prescription drug already in there. So there's a question here with retired military and applying for Part D. So here they're giving you medical. If they are saying that they don't have any prescription drug coverage, then yes, you would want to get a Part D plan. Yeah, so those of you that are have retiree medical coverage through the government, you are in great shape. When you're working for a private company, some companies offered the retiree medical plans, but many got away from that. So government employees have the retiree medical. And so if it doesn't, so that is what you would want instead. Once you give that up, your retiree medical, whether it's through the government or through a private employer, you're not going to be able to get it back. So you want to look long and hard. What is your coverage that you have? And then does it make sense to change? So when I've sat down with people before that are getting through the government, it usually that's their better option than going in and purchasing other coverage. Yes. So the question on the Medicare Advantage, yes, there are different types of plans, and one is very much an HMO where it's a set network. Another is like a PPO, and that's why I was saying that for those of you that are working, that it is more similar to what you were used to when you were working. The HMO type, the PPO type. So Kaiser has one. They do have Medicare Advantage, and yes, you can pick an HMO type with a carrier or a PPO type. Yeah. And then the question, again, TRICARE, I think you're going to be better off on the TRICARE than going this route. You're so fortunate to have the other coverage. Other questions?
All right, no more questions then. Well, I guess that wraps up our presentation for this evening. Thank you everyone for joining us. We will have the recording available on our YouTube soon. We will post a link on our Facebook when it is available, so then you will know that you can access it there.
Dottie, I was trying to type in. I'm sorry, and I was trying to type, but I just not typing fast enough. So just one question I have. So Medicare Advantage and Medigap are two different types of policies?
Yes. So Medigap is also from a private company. So you could go get a United Medigap, but it is filling in the gaps from Part A and Part B. So what you would have when you go to the doctor is that your claims would be paid from Medicare and from your Medigap policy, because it's supplemental. It picks up deductibles, copays. Remember the plans, you know, C and F and all of those plans. Medicare Advantage, although you have to have A and B, Medicare is not paying any of your claims. It's paid strictly by the private insurance company. So if you purchase a Medicare Advantage plan from United Healthcare, then you are having United Healthcare pay all of your claims, and they are paid because you've purchased B. United gets paid something from the government to help cover your claims, but all the claims are paid by that Medicare Advantage plan. So it's technically Part C under Medicare. Medigap, or the Med Sups are not a part of Medicare. They're outside of it. But be very careful. There are people that are out there saying buy Medigap and Medicare Advantage. You're not going to get both plans. If you have a Med Sup and you go to buy the Medicare Advantage, then you're not going to have the Med Sup anymore.
Okay, and one other thing, if I work in home care, the home care industry, and one of the questions that I constantly get with clients, and I know that you clarified this at the beginning, but I think it's really, really important for people to hear, is that Medicare does not pay for maintenance care if you need care for yourself or for your elderly parent to help activities of daily living.
Exactly, the
Medicare
ADLs.
does not cover that.
Correct.
And many people
It's for
think that
skilled care where you actually have to show improvements. So Medicare would cover like the first 20 days and then partially for up to 100 in skilled care. But the things that are custodial, like bathing, dressing, all of the activities of daily living are not through that. That's why you would go and you'd have long-term care insurance.
Right. Thank you. I deal with that on a day-to-day basis.
Yes.
And people get.
No, I started selling long-term care insurance back in 2001, actually. And that was something that came up all the time. And it still comes up because people think, oh, I have Medicare and that's going to cover it. It does not cover it. What will cover it, if you end up low enough, Medicaid will cover nursing homes. But then you're not going to have a choice in where you go. Remember, that's the program for the low income individuals. So, you know, there's coverage there. They pay for a lot of nursing homes, but Medicare does not pay for that.
Thank you.
Yeah.
Very good.
Mm-hmm.
Okay.
Any further questions?
Oh, I see. Wait, I think another question came in.
One from Tiffany.
So it says if you go from a hospital to a nursing home, how much does Medicare pay? So that's what we were saying. It's the first 20 days, it's at 100%, and then it pays a portion of 21 to 100 days. It's $176 coinsurance per day, and then that you're paying. And so you pay nothing for the first 20 days. You pay a set amount, the 176 in this case for 2020. I'm not sure the 2021 number, but after 100 days, Medicare is not paying anything. But you have to show improvement for Medicare to even be covering up to the 100 days. If you have a long-term care plan, you can get it where your elimination period that you've set would be what you're covering before the plan would pay for nursing home, but you can get long-term care plans that cover day one from home care. So actually right now, both of my parents are on long-term care. They're under claim, and they're both at home and approved for 24/7 care. For caregivers to come to the house. And my dad had broken his hip and then, you know, came home and he was able to start getting care right away because you just need to show that you need help for at least 90 days. And then day one, you get help. Okay. So just to reiterate again on the Medicare Advantage, there are certain things that are preventive that maybe some coverage on hearing or dental, things that aren't being picked up on the Med Sup. So that is the big advantage that I'm seeing on the Medicare Advantage. And I will tell you there were not as many people getting it. Now there are more people that are interested. So. And remember, when you first start on Medicare, you have your one-time welcome to Medicare physical, and then you get annual wellness visit if enrolled in Part B and annually thereafter. And certain immunizations, you keep hearing the ads on TV for the flu shots, for example, go get your flu shots.
I see another part of a question that popped up that says, do you recommend long-term care plans for everyone?
I actually do. Well, it depends on everybody's situation. So you have people that say, I have plenty of money and I don't need to worry about that. And the question is, do you want to use your money for your care, or do you want to be able to leave it to your kids, or do you want help? One of the things that we had found is that when you have the long-term care plans, you also have access to getting some help. So maybe you could even get a lower level, and so that you're not fully funding your own claims. The plans have changed over the years. So the plan, I've had my plan now for 16 years. And the plan that I have has unlimited. And so I could need it, in a car accident or a ski accident and then need help build a ramp to my house. I got it when my kids were younger, and it would do errands and different things if I needed to go on claim. And then I still would have it for later, so it wasn't for a fixed period, but it was a reimbursement type. So I would actually, my plan and my parents, you actually pay the caregivers, file a claim, and get reimbursed, and you have a maximum daily amount. There are plans out now, and came out years ago, that are indemnity type. So if you need care for 1 month, for 1 hour in a month, you get your full monthly amount. So you could take that money, say it's $6,000 a month, and spend it on whatever you want. It doesn't have to be reimbursing you for the amount that you've put out. And I will tell you, I mean, my parents ended up, Dad was going to cancel it a couple of times, and I encouraged him not to do it. The plans are becoming more expensive and harder to qualify for. So what they didn't realize, I had my plan in the first 10 years, the premium never went up, and now it goes up each year. And they just didn't anticipate the level of claims that are coming in. But people that have it and, collect on it have been really lucky. So I've seen this now from personal experience from my parents that, now they don't have an excuse that they can't have care because they do have the plan. So it's not dipping in that they feel like they're paying. And we also, the plans have the durable medical equipment. So my mom had a stroke, and we ended up retrofitting the bathroom. And then when my dad broke his hip, we had to do other retrofitting for the bathroom for him. And we had $12,000 each that we could use towards that. So there are things there. There are also, now on life insurance policies, you can get riders that help pay for long-term care. So there's a lot of different products that are out now, but there are definite advantages. And, it's great when you're younger and healthier to get it because the premium's lower, and we used to be able to say it really wasn't going up. They can only change it for a class of individuals. But if it's something that you want to look at, that is, like you said, Melissa, it definitely will cover things, and you can get comprehensive, so you can stay at home or go to assisted living or nursing home, or you can get just facility for nursing home. But a lot of people like to say, I'd like to stay home as long as possible. Or I'm going to go into an area where they have different levels of care. So that,
especially in today's environment, they want to stay home.
Right.
People want. So do you still sell long-term care?
Yes. Yeah.
Oh.
So if you guys want that, I can help you with that.
Yes. Yeah, I want to talk to you about a couple different things. So I'll get your number for Cookie.
So, yeah, you get it, and I put it on the last page of the slide deck too.
Okay.
And I happen to have it, Melissa.
I knew you did. I knew you had the inside
scoop. Over 15 years. She called and said, hey, we need speakers. So I was helping find speakers, some other speakers for you all.
Yeah.
And
I think long-term care would be a great thing to speak on, and especially if we can attract some younger people, because, it's important to get it while you're healthy.
Yes, exactly. Because they've gotten so much more rigorous in not accepting people than they had before.
Well, and much more expensive for less coverage. I've been doing a lot of investigating into it lately. Yeah. But just to give people an idea, if you need 24-hour care, it could cost you between $10,000 and $15,000 a month. So you have to have a lot in your pocket.
Yeah, it goes very quickly. That's why I'm saying it's great to have the plan. When I purchased it, I think I started, or even for my parents had gotten something. It was interesting. My dad came to me and said he had a plan his insurance guy had given him, which was giving him $100 a day with no inflation. So 10 years later, it was still $100 a day. And I'm like, Dad, this doesn't make sense, and we need to get you something else. So we got him a plan for a lower dollar amount, but it would go up. And then he ended up later even canceling the other one because the cost kept going up and you had a fixed benefit. But you get the escalators, so it adds up. So they're at like $270 a day or something that they could have. And so even though you get approved for 24/7, you still are capped with the dollar limit per day.
Yeah.
But now you can get the things like I'm saying, where you can just get, if you need some care and get a whole month's pay, you can go spend it however you want.
Right.
Okay. Hopefully this was helpful. I know everybody's in a different situation, but we work with a lot of companies, and they have employees. People are working longer these days, and so they have questions. They say, you know, I have an employee that's going to be 65. What happens with the health insurance? And that's what we're like, okay, well, you're under 20 or you're over 20, go buy Part B or don't buy Part B, or does it make sense to get out of the plan and go buy a Med Supp or get a Medicare Advantage? We have groups that we've worked with. I used to go around the country giving talks to groups who had like United Healthcare Medicare Advantage plans. It was becoming very popular. A lot of groups were offering that for their retiree medical coverage. So.
Okay, great.
Thank you so much. It's
You're
very
welcome.
helpful.
It was good.
Very
Thank you
good.
very much.
Thank
Take
you.
care.
Stephanie, we appreciate it.
Yes.
Good. You're welcome.
Thanks,
And yeah, feel free to reach out to me. I do consulting, so.
Okay.
Okay, thank you.